The Public Health Ministry has confirmed that there are 3 more positive cases of the Zika virus locally, pushing the total number of persons confirmed to 5. Chief Medical Officer Dr. Shamdeo Prasad and Director of the Vector Control Unit, Dr. Horace Cox, told Nightly News that since the emergence of Zika, to date there has been more than 70 suspected cases sent for testing. Of that lot, the Caribbean Public Health Agency, CARFA, has identified the new cases confirmed as being 2 females and 1 male.
All our samples are processed and then sent on to the laboratory in Trinidad, Carrefour Laboratory in Trinidad, where the confirmation. So far, the last count was 65. I think 10 more are sent this week, 10 or 20. So maybe 75 actually, because the last count we had was 55 plus 20 more were sent. So every week we send samples. So about 75, and of those, 5 now are reported back to us as positive.
What is our reality based on what you've seen happening?
Based on our assessment, we feel that there is no need for us to become over-anxious, overexcited. This is what we expected, that we would, as we continue to do more testing, we'll get cases from time to time.
One of the victims who reside at Timeri also tested positive for dengue fever. And based on the investigations, the woman may have contracted the virus while visiting Caneville, East Bank, Demerara, which has been found to have a thriving mosquito population. At least 3 other members of the woman's family, 6-member family rather, developed the symptoms consistent with the Zika virus, including rashes and conjunctivitis or pink eye. The woman's manifestations were deemed more severe, and as such a blood sample was taken for further testing. The other 2 victims of the Zika virus are 2 Cuban doctors stationed at the Diamond Regional Hospital, and both reside in the living quarters of the hospital.
At this point, we're of the opinion and we feel confident that there's no need to be worried, that we believe that in terms of dealing with Zika, we have the measures that are there and well afoot, and we're implementing them as we speak, and that the public will be updated as we get more information.
Everyone who is suspected of Zika with symptoms and signs, we take them through a battery of testing. They're tested for dengue first of all, then at Carrefour Lab they're all screened for chikungunya, and we found some cases that are actually chikungunya and not Zika. We found some cases that are dengue and are not Zika. So they're very similar, and the issue is that they're transmitted by the same mosquito. So I would really like that fear, if there is any fear in the community, that it should be directed against the mosquito, not against the disease, right? Let's all be fearful of this mosquito, and let's go out there and do every single thing that we can in terms of preventing those mosquitoes from biting us.
The first confirmed Zika case in Guyana was recorded as a woman who resided on the east bank of Demerara and Berbice, while the second case was that of a teenage boy residing at Eccles East Bank, Demerara. Mondale Smith, HGP Nightly News.